The offensive in the occupied West Bank comes as Israel agrees to put pauses on the fighting in Gaza to allow a polio vaccine campaign. The campaign is set to begin on Sunday and is aimed at treating more than 600,000 children. Casey Harrity is the team leader in Gaza for Save the Children. She told us it's critical to get that campaign started as soon as possible.
Thanks for featuring the story. It's incredibly important that we get this vaccine rolled out. Over 600,000 children will be reached with this vaccine campaign. This is protecting children here from polio, which, as I'm sure you know, was not here prior to the war. So polio is a direct consequence of the war, and protecting children from polio is critical. There are over 1 million doses of the vaccine that have arrived. The campaign will start on Sunday, and we're hoping for success over that 3-day campaign.
So we've heard that the Israelis are willing to put a pause on the fighting in the areas where the vaccine campaign is supposed to roll out. There is a lot of trepidation around this because there's been no ceasefire agreement, and yet there's an agreement for pausing the fighting for this campaign. Just give me a sense of how you all are feeling as aid workers on the ground.
What you said is absolutely critical. There is no ceasefire here. In the month of August, nearly 300,000 people were displaced, some for a 6th, 7th, 8th time, moving from relocation orders issued by the Israelis. We've been here in Dar el-Bala. We've been listening to the fighting. To the north, we can hear bombs. To the east, there have been tanks. To the south, there have been more targeted airstrikes. And of course, as you know, to the west is the ocean. So we're really surrounded by the war here. We're cautiously optimistic about the pause, but we have to be clear that there still is no definitive ceasefire.
And on that point, we've heard from the Israelis. What about Hamas? Does Hamas pose a threat to your operations?
For our operations, the threats here are that we do not have enough supplies. We don't have sufficient food to deliver. We don't have sufficient supplies for basic needs of the population. And there's a threat of the airstrikes. We are in an active conflict zone, and all sides need to agree to a ceasefire.
Let me talk to you about the boosters, because while there's hope for those 3 days of allowing the vaccine to get rolled out, these vaccines need booster shots. And so what is the agreement about pausing fighting again a month from now?
At the moment, we're really taking this one step at a time. As you said, we'll have to repeat the campaign again in September for that second booster. We'll see how this first round goes, if the pause holds, if we're able to implement this safely, if the health workers are able to do their jobs, if the population is able to arrive at the clinic. There's a lot that remains to be seen. We need to get through this first round before we can start planning for the next round.
If the vaccination rollout does not happen and polio starts to spread in this war zone, what is the worst case scenario, Casey?
We're already in many ways living in a worst case scenario. The fact that polio is here, the diseases that we already see spreading, there's been an increase in diarrheal disease, an increase in skin infections, chest infections, hepatitis. We're already seeing a scenario where people are living without adequate food, without adequate water, sewage running through the streets. They don't have safe shelters. We're living under constant bombardments. So truly, we're nearing the worst case already. Polio will add another layer to the devastation that we're seeing here in Gaza.
Casey Harrity is the team leader in Gaza for Save the Children.